Hi, I'm Dr. Larry Geier. I'm a medical oncologist with Kansas City Cancer Center at our South location, and I'm the lead physician for what we call our GREAT program. I've been an oncologist for 25 years, which is 25 years of basically chasing cancers. Very few opportunities to be on the front end, that is on the prevention side of keeping these cancers from occurring in the first place. We developed this program that's called the Genetic Risk Evaluation and Testing Program, or GREAT, which allows us to analyze the risk profile of various patients for various cancers and actually develop strategies that allow us to prevent cancers that were destined to occur. Kansas City Cancer Center's GREAT program has been nationally recognized, at least in part because we're unique in a number of ways. For starters, when a patient comes to us for genetic risk evaluation, you're going to meet with a medical oncologist rather than a genetic counselor. This oncologist has special expertise in cancer genetics and therefore is in a best position to evaluate those risks and then manage those risks. Key to this evaluation will be development of a full family history or pedigree related to any cancers occurring in the family. We're particularly interested in such things as the age that a cancer occurred, the pattern of cancers in the family, whether anybody had multiple cancers, etc. And by analyzing this pattern, we can determine the likelihood that a bad gene, one of these cancer-causing genes, might be floating around in this family. If so, the risk for future cancer may be extremely high, and we need to develop a totally different strategy for keeping that cancer from happening. So how do you know if you might be a candidate for this kind of evaluation? Well, again, look at your family tree. Are there cancers occurring more than once within your family? For instance, breast cancer occurring in several people on the same side of the family, or ovarian cancer, or colon cancer. If any of these people were younger than age 50 when they were diagnosed, that would be of special interest. If anybody has had more than one of these cancers, for instance, cancer in both breasts, that is a red flag that gets our attention. Any of these things developing might make your family one that deserves further evaluation. Once evaluation has been completed, if we think that genetic testing is appropriate, then we will send off samples to actually analyze for the appropriate genes. Now, this is expensive, high-tech testing, and I'm often asked whether or not insurance covers this. Well, that's part of the reason for the consultation, is to determine the likelihood of there being such a bad gene, and most of the time insurance will cover this if certain criteria are met. Again, that's our job to figure that out. It's not really necessary for you to try to figure that out with your own insurance. Insurance does cover the consultation itself because it's, generally speaking, a doctor sending to another doctor. So the important thing at this point is for you to know your cancer family history. Make a few phone calls, send a few emails, find out about Aunt Harriet and Uncle Sam, get those cancers down on paper. If it looks like there's more than there ought to be, well, we're standing by to help you analyze that and determine whether or not we need to do anything more. At Kansas City Cancer Center, we don't just treat cancers, we manage the risk.